Time being 6:01 p.m., I would like to call the Board of Health meeting to order. All members present. So looking at our agenda for this evening, first item up, COVID-19 update. So Marty, if you'd be so kind.
I would love to, thank you. So first couple things, one of the things that is happening this weekend that was postponed due to COVID-19 is the household hazardous waste collection day in Hanson. Our flyer is on the website. Please pre-register. This is the first one that they're having because of COVID-19 in a very, very long time. And you must pre-register. Alex is volunteering at that this weekend. Thank you, Alex. Second,
no problem.
COVID-19 cases in town. So I know that this is a rather controversial topic right now. What is the state is reporting different numbers than what we are reporting in town. Remember that our reporting from the office comes from Maven. When we look at Maven, which is the system that the state uses for reporting, we are telling you how many cases we have active as that moment in time. The state is doing it a little differently. So when I log into Maven and when Lindsay logs into Maven, we can tell you that we have 5 active cases in town. We can tell you the running total. And we can also show you the number of contacts we have if we wanted to put that out. But that's less important than the actual number of cases in town. So right now, we have 5 active cases that are being traced and tracked in town. The state's numbers are going to be a little different because they only update them every Wednesday. And Lindsay, could you please explain the mathematical formula?
How did I know that was coming out?
Yeah, that
Okay.
the running total, and I'll let Lindsay explain that.
So we're talking about how they come up with the color-coded map.
Yes.
Okay. So the state has come up with this mathematical equation, and they take the cases for day 1 through 14. Every day, they add case day 1, the total cases, divide that by Abington's population. Then they add that to case day 2, divide that by our population, up all the way up to 14. They then figure out that number. It is then divided by 14 and multiplied by 100,000. So
and
there's
that will give us our total running case days for a 14-day average per 100,000 people.
So the Wednesday maps are a 2-week running look back of what is happening in our town. When Marty and I sit on Monday morning, or today being Tuesday, I have a running track, like he said, through Maven, and I'm able to say, all right, we got, right this second, we have 6, 5, what this morning it was 6, I was clearing someone off that cleared yesterday. And so when Marty and I update, you guys, the board, and the town website, we're updating very much in real time. The state, there is a little bit of a lag time because if cases are revoked, if cases are made from a probable to confirmed, there's a lot more that go into it than just X amount of people have gotten tested and what their test results are. So for what the town sees, that is Marty and I on top of the numbers very much in real time, where when the state releases, it's kind of a retrospective look backwards at what has happened in the previous 2 weeks and how they factor their numbers.
And another very important thing to consider is we don't always get the test results on the day they start their quarantine. Sometimes we will get test results and they're already on day 8 or 9 of quarantine. So if it's a weekend, we can have had a positive test and they're already off of quarantine by the time that we can get around to talking to them. And so that will come off of our real-time test, but it will have stayed on the 2-week running number from the state. So we are reporting the exact number of cases in town at that exact moment. And it is as clear as we can get it. And we try to update it as often as we need to, because if we updated it every day, it wouldn't be an accurate number because people fall off, they go back, they come on, it's important to do it once a week in my viewpoint, because I can tell you that week, these are how many people we're tracking. And I think that's a more accurate number than what the state's putting out, because I'm telling you right now, today, 5 cases in Abington are being tracked. And then the state's going to do their retrospective viewpoint for the 2 weeks. I hope that clears up any confusion. And if you have any questions, I implore you to call the office and we'll do our best to answer them as best we can.
Yeah, please definitely reach out, because I know that there's a huge concern about numbers being reported. And, you know, for us, like Marty said, to reiterate, when we get made aware of cases, I will jump on the phone immediately and follow up with these cases. They get put on our active case list.
We contact first responders to make sure that they're aware of any health they could potentially be endangered. And these are running things that we try to stay, and we're kind of proud of that, was that those people get contacted as fast as humanly possible. They get put into our database as fast as humanly possible, and they get notified of any contacts, or their contacts get notified as fast as humanly possible. I hope that clears up any confusion.
Everybody that needs to know knows.
Yes.
Relatively from within hours of me receiving an email, I can personally say that unless it's late at night, which has only been one case that I've, since July 1st when I started, it's within hours of me being notified that there's a case. Now, like Marty has explained earlier tonight, and I know in the past, if someone tests, so it's September 8th, if someone tests, you know, it's not an instant that this information gets uploaded into this system. There is a lag time that is just generic to a mass reporting system, and not mass meaning the state, just broad, huge reporting system. And so we update and make aware all the parties that need to be updated and made aware as soon as we know that there is a positive case in town. You know, I'm really proud of the work that we have been doing to keep the town updated, you know, as quickly as we're able to.
And the other thing is, we're not turning any cases over to the contact tracing collaborative. We're keeping them all in-house now because we have the means to do so. That way, the townspeople are getting phone calls from residents, us, and town employees. They're not getting calls from the contact tracing collaborative right now. And I would love to keep it that way for as long as possible, as long as our case numbers stay manageable. So that's why we have to keep on track of our exact number, so I know that the cases don't get sent to the contact tracing collaborative, and we can keep them in-house. And of course, there's transparency. I don't want anybody to know, or I don't want anybody to doubt how many cases are in town. It's important for everybody to understand the number of cases in town so they can make educated, good decisions in whatever it is that they're going to do.
Thank you. And just for the folks listening at home, if you want to reach out and call the health department, the phone number is 781-982-2119. I was going to give out your personal number, Marty, but I won't do that to you.
I think everybody has it already anyway. So.
I do want to say thank you, Marty and Lindsay, for all you're doing to keep everyone informed, to keep us informed and stuff. I know, Marty, you and I were talking about it earlier today, but just the amount of hearing from residents in town, and they appreciate how much transparency is coming from our department, and especially you and Lindsay. So thank you.
Thank you for saying that, and you're very welcome. And now is not the time to keep secrets. This is not. We're talking about a disease that we know could kill our grandmas, and I don't want that to happen.
Absolutely.
So speaking of that, while we're talking about our COVID update, can you give us any update on any complaints or the process of filing complaints? I've had people ask if we're getting any.
Oh, we get them. They never stop. So I would first direct people to the DPH website on the right side link of our website if they wanted to. It's under news and announcements. If they want to submit an anonymous complaint, that's probably that's probably the easiest way to do it. Or you can always call the office, or you can always reach out to us via email. Our emails are linked on the website. Send me an email if you have any concerns or complaints. And we've gotten a lot of complaints from the state regarding some town leadership making some maybe negative choices or the appearance of those. So I would just ask that, you know, all of us need to be leaders by example. Please do your best to do the right thing because it's the right thing to do. So please, you know, wear your mask, wash your hands, wear your mask, and then don't forget to wear your masks. And also just wear a mask. That'd be great. Oh, and don't go anywhere if you're sick. We had a huge spike in cases last week because people were out and about when they weren't feeling good. Okay, listen to me. Don't go anywhere if you're sick. Stay home. Now's not the time. You don't need a hamburger at the place. Get it to go. Stay home if you're sick. Thank you.
Did you watch the Stephanie Miller show? Because that was it.
That's going to be huge going into the school year. And I'm just going to throw my 2 cents in while Marty said stay home. For parents watching, teachers watching, if there is a question, stay home. No one is going to fault you for staying home because we can stop a lot by saying, oh, hold on, let's get you evaluated. And then, okay, it's an ear infection. It's something else. But if we're like, I think it's that, and we expose a lot of people. So again, just if you're not feeling good, just home is where you should be.
Stay home.
And that's an excellent example of, I know the restaurants and businesses in Abington have been excellent about doing everything that they need to do. And then you get one sick person going around and
ruins it for everybody. Imagine, so here's a good example. The places that we've had small, clusters have done everything right. Imagine if they hadn't. Imagine if they had just, thrown caution to the wind and not cared about it, not been enforcing mask protocols, not been doing the things they've been doing. It could have been way worse. So please stay home when you're sick, wear your mask when you're out, stay home when you're sick, and then,
wash your hands, wear your mask.
Or mask.
Mask, absolutely. Social distancing. I know people have spoken about this on social medias before, and they've brought it up to an issue. Even though we have only 5 active cases here in Abington, still wear your mask out in public, follow social distancing protocols. Because I know there's a lot of people in town who are saying, oh, our numbers are low, so everything's fine, let's go back to normal. No, we need to be cautious. It's rather be safe than sorry.
Yes, all of that. What he just said. Do that.
That's why we were resistant to posting the numbers to begin with.
Yeah, if you are lackadaisical, if you are cavalier with the attitude, you could put somebody's life in danger. So please don't do that.
Yeah, I know when I put up the numbers and stuff, I always leave a message saying, always make sure that you follow the social distancing protocols and wearing your masks. I mean, because people like seeing the good numbers, but at the same time, you also need to be realistic. And so we need to follow these protocols. So thank you.
Yep. And just for our listening public, we sometimes are a little tongue in cheek here at the Board of Health. We do realize that this disease affects the immunocompromised and people with underlying conditions as well as grandparents. So thank you for your input. We get it. Any other discussion on the COVID-19 pandemic? Our other agenda item is related or somewhat to that. So next on the agenda is discussion and vote whether to offer pediatric doses at our planned flu clinic.
Okay, so to talk about this, I kind of have to talk about what we've been doing for the last few months. So going back to April, May, June, we knew going into the fall that the flu immunization was going to be a very important aspect of our continued fight against all diseases, and particularly COVID-19, because one of the benefits of having a town flu clinic is we can subtract an appointment for a pediatric or for a adult dosage at a healthcare provider's office or maybe even a CVS. And every time we do that, we help take some of the burden off an already overburdened healthcare delivery system by having an alternative method. So that was the thought behind Abington, the town of Abington hosting its first pediatric and a more robust flu delivery clinics, and then doing it in multiple locations, not just the senior center, not just the high school, but in a bunch of other locations in town, and then not just during working hours, either on a weekend or after hours, where we can get maximum participation. And the thought process behind that was just what I said. It was us trying to get a a few people out of the healthcare delivery system stream by offering it in town to parents and to people who have no concerns about getting it. Because if you have any concerns about getting it, then you should go through your pediatrician, you should go through your primary care physician or family practice doctor, and they're with them, through them, you should make the right decision for you and your family. We are aware that about a month ago now, there was a mandatory regulation that came out that said all children under the age of 18 in Massachusetts will have their flu shot prior to December 31st of this year. And we just wanted to make sure that people understand that our flu clinics are not directly related to that. Ours are to try to help people get the vaccination instead of going to their doctor as an alternative method of delivery. That's what we were doing, and that's what we will continue to do. But because of the highlight that has been put on it, because of the flu mandate, there's been a lot of, we'll call it pushback. There's been a lot of, people with some genuine concern that, is this something that we should be offering? So that's the genesis of this. And when I say a lot of work went into this before the mandate came out. How many pages was the Medicare, Medicaid application, Lindsay?
45.
45, and that's not just like 45 normal pages. That's 45
Yeah.
Medicare, Medicaid pages. That's like there's an X in it there. So we the state is aware that they needed to add additional resources. There's the scheduling. We've been working on this for a long time. But I think it's important that all of our residents be informed and that the board makes an informed decision on whether or not we should do a more robust program for the town that would include pediatric doses. Lindsay, did I cover all of the things?
Yeah, absolutely. I know, so when I started the 1st of July, I came in and I sat in Marty's office and we kind of talked about goals and what we wanted. And I said, flu shot. He goes, it is July. I said, nope, we got to start it now because
I didn't want to talk until August.
we have to be ready. And, taking over the role from the VNA, last year they vaccinated a certain number of individuals in the town of Abington. And I said, if we could double that, that would be a great goal for us. And we sent the survey out. We did a lot of work in the background to be able to get the vaccine and get everything that goes into running it. It's not just showing up and giving injections. There's a lot of work.
A lot of work
that goes into it. And, when the mandate came out, it stopped us in our tracks only because we didn't want people concerned that we were doing it for that reason. And so a lot of talk has happened in the office, and that's where we're at now tonight with you guys. Is we want to make sure that you see both sides, you have all the information, and we make the right choice for the town.
Now, Marty, can I ask something? We've always done flu shots in Abington.
Never pediatric.
Well, I know what I brought my kids when I got flu shots myself. We went to the senior center and I brought my kids and they got theirs. I mean, what age are we talking?
So we were looking to offer for 3 and up, and that is, and advertise it for 3 and up. It has never been, in talking to the VNA, it has never been that we are encouraging as many residents as we can to come. They've offered vaccines, but it's definitely hasn't been for the younger pediatric side, from my understanding with the VNA. It was older kids, if offered.
Maybe they didn't do it those few years that we went over to the senior center, but I mean, we do flu shots anyway in town in general.
Well, see, the problem was the South Shore VNA through their, it was a contracted thing through the hospital.
Yeah.
We don't have that anymore. So we
that's right. That's right. I remember when we talked about that.
Yeah. So we have to come up with all of this from scratch. We have to basically build a small healthcare delivery system out of our office, which is extraordinarily difficult.
Which is great, and I'm glad you guys did that. But my question is why do we have to explain, like, you guys did the work, but what's we've done flu. Is it just because of state mandate? We don't want people to feel like we're pushing something because all you're doing is adding kids.
Well, I think the fact that we're adding kids is kind of the big
And
deal.
I myself, like I said, have had my child vaccinated with the flu shot in Abington at the senior center when we did it through the VNA.
Through like
Through the town, when the town offered it.
okay, so I guess the disconnect here would be that in the 2 flu seasons that I've been here, they
Yeah.
haven't given any pediatric doses. So
Okay, well, maybe they changed
since this is our first year doing it on our own as a
on
town,
our own. Okay.
it's important that we kind of like. So first of all, I'm going to be straight up front here. Everyone should get the flu shot that can safely get it. That is from years of medical advice and sound practice and being a healthcare provider in the military. If you can get the flu shot, you should get the flu shot. But I just want to make sure that everybody is on board with why and what we're doing. And since I've been here, we've only given out adult dosage at the senior center at the high school.
So we just have to make a motion to do what? What do we need a motion for?
So I just want to quickly chime in if everybody doesn't mind. Just so that everyone understands where Marty and my concern about saying, even though the prep work was done before this mandate came down, we want to make sure that the town and our residents and the board who know the work that has gone into this prior to this mandate knows that we are representing the town of Abington. We are offering this, as Marty said earlier, to lessen the burden on the pediatrician's office. Because I know for me, bringing my 2 kids to a town-run clinic as opposed to bringing them into the pediatrician's office, which it's a process in and of itself right now, and the models that we're trying to set up for these clinics, it's not, we want to make sure that the understanding isn't that we are saying, Abington's offering vaccines, you have to get it because this is the mandate. It is more than that. It is that we are trying to do a service to help, and we don't want it to look as though we're pushing anything and forcing anybody, I guess is where our concern was.
This is Christina. So just to kind of frame the question as I understand it to make sure I'm on the same page, it seems like the issue at hand is by us offering this flu clinic today and voting, the Board of Health today, we are not voting on choice about the flu vaccination, whether people have the choice to get it or not get it. And it's not about us supporting whether it's a choice. We're really just making a vote today about accessibility. Will pediatric patients have access to this healthcare benefit that we offer to all other Abington community members? And it's kind of a vote to include or exclude pediatric patients. It's not a vote about the choice of the mandate, nor does it show any support or denial of that, right?
Right. Yes. Well said.
Yes.
That's very well said, yeah.
Bingo.
All right. I'm
So
on
was
board.
that a motion? That sounded good.
Uh-oh.
I was going to say that
That
sounded
sounded like a good motion to me, Christina.
Does anyone else have any questions or comments to the discussion?
The only thing that I would add to the discussion is I think our department, maybe more so than some others in town, has made a concerted effort through all of this to be transparent. And I think people know that. If it helps, maybe if this is something that we decide to go forward with, I could implore our various members of the board to, do like PSAs to get it out there that this is a service that we are offering, and to communicate the same message we're trying to here, just in multiple platforms. So I don't mind getting up and saying, because people are going to think what they're going to think. That's all. Sorry, I ran out of steam.
I agree.
I'm up for that.
So yeah, I'll entertain a motion if you got one, Christine.
How do I do that? I'm sorry, do I say
Same way you just did.
I'd like a motion for the Board of Health to vote on whether we expand the flu clinic for pediatric patients to be included.
I will second that motion.
Okay, so not to be a stickler, but I have a motion for a vote. Do we want to have amend that motion to either approve or disapprove a clinic as opposed to voting on it? Because it's already on the agenda to vote for it.
Yes, please amend it as you need to.
Okay, so the amended, what's the word? Motion is to vote on approval of including pediatric shots within our flu clinic for this year and moving ahead with the work that the health department has already started. So that's the motion. We have a second. All in favor, raise your hand and say aye.
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 It's unanimous. So motion passes.
I've never been excited to get more work. That's weird.
That is weird.
Well, it's important work.
Yeah. And I think most people will understand and appreciate that we're just trying to make everybody's life easier. And if it becomes a problem, then we'll all get up on our soapboxes and.
And remember, the statement is still in place that if you have any doubts, if you have any reservations whatsoever, just talk to your family physician, talk to your pediatricians, make the decision that's best for you and your family. But we will offer it as a service, and we will do the absolute best we can.
Just before we move on, there was a question on here just asking if the shot is for seniors as well. If anybody can confirm that.
Mm-hmm.
So that would be for all. And again,
Yep.
Based on your doctor's advice.
Yes, our seniors will still get a shot clinic at the senior center. Hopefully 2 this year. We only did 1 in the previous couple years, but I'm hoping to expand that a little bit, and especially with COVID, because there's limited access to the building at this point. So I feel like it'd be best if we had, and there's still limitations to how many people we can have in there. So we're hoping to do some pre-registration as much as humanly possible, and more than 1 date so we can accommodate as many senior citizens as possible over there.
Would pre-registration also help? I mean, I'm not sure how this works in getting the flu shot. Like, are you able to return unused flu shots if you?
Well, we're not really sure about how it's working right now either, because we're supposed to get a system called PrepMod from the state, which is going to help us with preparation, with the pre-registrations and all of that, to make sure that, because you have to, there's a litany of paperwork and a lot of I's you got to dot and T's you got to cross before we can give you the shot.
The state will be rolling it out. It's an end-to-end system that will help with all the way from pre-registration through to follow-up and documentation and all of that. So here's to hoping we get it soon.
Sooner rather than later. I already got my flu shot this year.
And to answer your question, you are able to return a percentage of vaccine that is ordered and unused, but your percentage is based off of previous year's performance. So where Abington, the town of Abington municipality's health department is running their first clinic, we are jumping hurdle after hurdle to get what we need. And so the long answer, I guess, yes, there is the ability to return vaccine. It's just a little bit convoluted this year, being our first year running a municipality run clinic.
Just for context, last year, the South Shore Visiting Nurses Association gave out 90 flu shots to residents in town, 90. Our survey indicated that at least 1,100 people were interested in coming to that.
Wow.
So that is 10 times the number of people.
Which we're so excited about. I was ecstatic when I started reading our survey results. But it is we've done a lot to get to this point. So thank you guys for, helping in this decision.
Thank you.
Thank you.
Thank you.
And we'll need lots of volunteers during the shot clinics to come out there.
Oh, I guess I'll come out.
We knew you would.
Just work for our pay.
Yep.
All right, excellent. Well, that's all our agenda items for this evening. If there's no other discussion, I would entertain a motion to.
I'll make a motion to adjourn.
I'll second.
I have a motion to adjourn in a second. All in favor, say aye.
Aye.
Bye.
Aye.
Meeting adjourned.